Good afternoon and welcome to the Department of Behavioral Health update. It is August 26th. I'm DeWan Utek. We'll jump right in. By the numbers, we now have 214,349,897 cases across the world. This has resulted in 4,470,135 deaths. In the United States, those numbers are 38,302,659 cases and 632,911 deaths. In California, we are seeing that positivity rate go down slightly. This is a welcome sign. We'll be watching it very closely. We went from about 6.1 to 5.4% over the last week. However, in our hospital, in Fresno County, we went up by another almost 2,500 cases. We have had a few more deaths in the last 7 days. And then I wanted to start sharing some information from you that's newer to show, and that is youth. Particularly as we focus on vaccination, remember youth under 12 are not eligible for the vaccine yet. And so a lot of the conversation you'll hear that's encouraging all of us to get vaccinated is that we're trying to protect people who are immune compromised and don't have that immune response that we need from the vaccine. They may have been vaccinated, but we just can't get their body to a level where they can fight off the virus, as well as kids who are younger than 12 who aren't eligible for the vaccine. And so we'll start tracking this number as well, which are cases for kids. And you'll see on this slide, and it's a little hard to read, the upper left corner is daily case counts for youth. And then down below you see cumulative by age. So it starts with under a year, and then 1 to 3, and then up to 5. And so you see that there's not as many, but I will say that that first bar on that bottom bar graph is 1,000 cases. So we've had over 3,000 cases in Fresno County of kids in those younger ages where they're not quite eligible for the vaccine yet. And I'll be reviewing their hospitalization rate, their vaccination rate, and some other information as we go through the slides as well. So in terms of hospitalization, we're now up to 395 individuals hospitalized. It's fluctuated between 395 and 398 the last few days. The good news is it's stayed right there. It hasn't went above 400 again. But the number in the ICU is now 78. And so if you look to the right, you'll see that that is our highest ICU number for a while, 68 last week with 328 hospitalized. So something we're watching closely. And then the other thing really to pay attention to is 8 ICU beds available. That is not many ICU beds in a county the size of Fresno with over 1 million people. When we have so many people getting COVID and so many people hospitalized. So something we're watching very closely too. And then of note, hospitalization for youth at this point seems a little disproportionate to cases. So it does appear in a very early review that we're seeing more youth hospitalized than what would be accounted for in the cases. So if you look at this slide, this is both Fresno and Madera County hospitals. And the reason Madera County is included is because Valley Children's Hospital is in Madera, although the majority of youth in Valley Children's are from Fresno County. And so this shows you over the course of the pandemic how many youth have been hospitalized. The lighter orange or red color on your screen is hospitalization. The darker is ICU. So you'll see that over the last few weeks and month, we've seen the highest hospitalization of youth since the pandemic and the highest in the ICU since the pandemic. This likely is due to the Delta variant, but something, again, that concerns us, and I'll talk a little more about that in a minute. In terms of testing trends, we continue to see that number remain high. Again, we've went down a little bit. We were at 11.1 last week. We're at 10.3 this week. Still very high, still in the purple tier, and something we'll watch closely. Vaccinations, we're now well over that 1 million mark. We talked about that last week, that we likely would get there by this week. And so we are seeing an increased vaccination uptake, meaning that there are more people getting their first vaccination in the last few weeks than we had seen in many weeks prior to that. We'd seen a real decline in vaccinations for first doses. It seems that as people are seeing their friends and family get hospitalized and sick with the Delta variant, hopefully that's helping them make the decision to get vaccinated. I did have another, I've had three people I know in the last few weeks personally who got COVID, one of whom exposed me to COVID. The two who were vaccinated, one got hospitalized for a couple of days and then back to work. One did not get hospitalized, has been relatively fine. The unvaccinated friend of mine, I think I mentioned this last week, my age, healthy, very fit, no underlying health conditions, hospitalized for 3 weeks and came very close to dying. So that's one anecdote, but certainly something to keep in mind. And then for youth, this really illustrates that for youth, and this is under 17, remember only 12 to 17, or under 18, only 12 to 17 can get vaccinated, really small percentages, right? So we have quite a few youth in Fresno County. Of all youth in Fresno County, it represents only 13% who've had their first dose. So largely the youth in our county are unable to be protected. They're looking to us to help protect them. So in summary, we're now up to about 61% of individuals in Fresno County who are over the age of 12, meaning eligible for vaccination, who've gotten at least a first dose, another uptick of about 1.1%. And then for individuals 65 and older, 87.1% have got their first dose. So again, a slight increase. Continue to reach out and getting those individuals who either were reluctant to take the vaccine or had concerns and now want to have it, or just had a hard time getting to the vaccine. So what else is happening in Fresno County? The positivity rate, as we said, is slightly decreased. Hospitalizations appear to have plateaued for the last few days, but still at a very high rate, just under 400, and staffing remains with critical shortages. It looks like we are getting a little bit of help from the state, but that's something we'll need to watch very closely. Deaths are increasing again, and with that increase in hospitalization, we should expect an increase in deaths. And then all counties now are in the purple tier. If you look at the next slide in terms of our case rate, you'll see that California is leveling off a little bit, it appears, and we're still going up a bit. So our hope would be that we would follow that curve and level off at least a little bit. A lot of the modeling shows that we'll peak somewhere around Labor Day, but that likely we will plateau as opposed to come right down. So we're going to have to, again, watch that closely. This next slide just shows the counties being in the purple tier. Last week we had a couple in the red. Now we're solidly all in the purple, which is the worst tier. And so, in summary, for California, new COVID cases seem to be leveling off, still high, hospitalizations remain high, deaths, just like the county, expected to increase. And again, the vast majority of cases, hospitalizations, and deaths remain unvaccinated individuals. You will for sure hear of people who have COVID who got vaccinated, as I shared with you my experience. You will for sure hear of people who get hospitalized with COVID. Gave you an example in my own life. And you will occasionally hear of people who die of COVID who've been vaccinated. Largely, we are finding that those individuals are the ones who have underlying health conditions, elderly, etc. And so I wanted to share a new CDC study that came out. They looked, it's a July 2021 study, looked at Los Angeles, California, during May 1st to July 25th of 2021. So well after vaccines were widely made available and you got at least 2 weeks past that final dose. And they looked at 43,127 COVID positive individuals, and they compared vaccinated to unvaccinated individuals. What they found is you are 5 times more likely to get a COVID infection if you are unvaccinated, and 20 times more likely to be hospitalized. They haven't produced the death data, but that I would expect would be even a higher amount because of the hospitalization rate. And so again, more and more research and facts and data are coming in illustrating the effectiveness of the vaccines and the severity of getting COVID. And that's where you really have to weigh the risks benefits if you still haven't made the decision to get vaccinated. What are the risks, the likelihood you could get COVID? And if you got COVID, what are the chances that you could become hospitalized or die versus the risks of the vaccine? And at this point, to be really, really frank with you, there are very, very rare and few risks of the vaccine. And so, and I'll talk about some of the myths that are out there in just a minute. All right. Nationally, cases remain up, especially in the South. We talked about that last week. The booster dose is now recommended for all persons who received Pfizer or Moderna 8 months after the second dose, so as early as mid-September. I have gotten questions about whether or not we would offer that booster. That remains to be seen. It's possible as we go through just routinely offering the shot, if we have extra doses left over, we might make the booster available to people, but we'll share that with you as we know it. And then COVID, or CDC did approve Pfizer. I think I mentioned that last week. It was kind of late-breaking news. And so it's no longer under emergency use authorization. It has full approval from the Center for Disease Control and FDA. All right, children and COVID. I did want to talk about this a little bit. We haven't talked much about it in the past. There is a low incidence of COVID with kids as far as deaths go. And most of the deaths that have occurred in kids with underlying health conditions. However, that does not mean that COVID doesn't happen in healthy kids. I'm hearing more and more reports of that. You saw the numbers in our cases. Or that kids aren't getting hospitalized, because you saw that as well. We're definitely seeing more kids getting hospitalized. As the case rate goes up, we're seeing more kids getting hospitalized. And one of the things we're really worried about is a thing called multi-system inflammatory syndrome. This can happen in adults and kids. It's not just it doesn't just happen with COVID, but we are seeing it associated with COVID at a higher rate than you would expect to see happening normally in the population. It is a rare but serious condition. It's where different parts of the body become inflamed. You have an inflammatory response. That can include the heart, the lungs, the kidneys, the brain, the skin, your eyes, gastrointestinal organs, and can even result in death. There's been somewhere around 32 to 37 deaths that have been directly attributed to this syndrome happening in kids who have COVID. The median age is 9 years old. That means a lot of the kids getting this are younger than vaccination can afford. They don't qualify for the vaccine. 63% of the cases occurred in Hispanic, Latino, or Black non-Hispanic children. Another example of the inequities, the health inequities we're seeing, and the higher risks to our Latino and Black populations with COVID, and particularly to kids. And so this is another reason we really want to have that herd immunity that comes with more of the population getting vaccinated, because these kids can't protect themselves. They can't get the vaccine. And we really want them to go back to school, and we're hoping that they wear a mask and stay safe in school, but they're interacting with adults all the time, and so that risk is there. And while it might be a low risk, the consequences are really bad when it does happen to kids. So I wanted to show you the incidence of this across the United States. The darker the color, the higher the incidence. Guess what? California, we have the worst incidence of multisystem inflammatory syndrome. And you can see by age group that 6 to 11 is the middle column, and that is the highest population. Again, and to the left are the 1 to 5 and under 1. Again, these are kids who cannot get vaccinated, and so that is where this syndrome is occurring. And this shows race ethnicity. The 2 left columns are Latino and Black. The 3rd column over is white. And so clearly across the United States, this is disproportionate representation in our Latino and Black children compared to what the population represents in the general population. So this is really something that, tugs at the heart for sure. But the way to protect kids is for the rest of us to get vaccinated, the rest of us not to spread COVID amongst this population. All right. One more thing, general information. I haven't talked about the RO. The RO basically tells you the number of people that one sick person will infect on average. And so just to show you, the lowest RO showed on here is the 1918 flu and Ebola. And that was about every one person infected 2 people. And then COVID-19 in its early stage was about 1 to 3, so every infected person was likely going to infect 3 people. HIV and SARS is 4 people, and COVID-19 with the Delta variant is 7. So that's 2 times, a little over 2 times as much as the original COVID with this Delta variant. Then you see chickenpox is 10, mumps and measles are 12 and 18. And remember, chickenpox, mumps, measles are all things we get childhood vaccinations to prevent us from getting them because they're so contagious. And largely we've, eradicated that in the population that's vaccinated. And so just wanted to share that with you, just to show you how much more infectious the Delta variant is, how much more risk we put kids at when we let COVID run rampant in our communities, and perhaps help you consider what you could do to help these kids by getting vaccinated. All right, a few Mythbusters. One is that COVID doesn't severely affect children, and California has a negligible burden of this multisystem, and I hope what I shared with you helps to undermine that myth. Another is that vaccines for COVID are contraindicated in pregnancy and while breastfeeding. Remember that study came out a few weeks ago. There's no risk of miscarriage, and in fact now we know that there are severe risks for moms and babies when they get COVID. And so again, you have to weigh that risk-benefit. There's no known miscarriage or complication risk for pregnant and breastfeeding women, no known risks of infertility, huge known risks if you're pregnant or breastfeeding and you get COVID. And so weigh those risks and make the best decision for yourself. Next one, monoclonal antibodies don't work on new variants. We know for sure now that they do have an impact. They help you fight that off. A reminder that monoclonal antibodies are a treatment for viruses, and in COVID, they have to be given when someone's symptomatic but not in the hospital. So people have to recognize that they're sick, be tested for positive COVID, and then get that treatment before they're so sick that they're hospitalized. Once they're that sick, the monoclonal antibodies don't work as well. And so they want to keep you from needing hospitalization. And so if you do get COVID and you're not yet hospitalized, talk to your doctor about getting monoclonal antibodies, as they might keep you from getting hospitalized. Another myth, ethylene oxide is used as a sterilant in nasal swabs, and that myth is that it's harmful, changes your DNA, and increases the risk of developing cancer. The use of ethylene oxide, it is widely used to sterilize medical equipment and devices. That use is tightly regulated, and at the very worst, any amount of ethylene oxide that would be on a swab is in such trace amounts as to be harmless. So there's no evidence at all that this is true. And then the final one, and this is the one that kind of makes me shrug my shoulders and even chuckle a little bit, is the use of ivermectin. Ivermectin is a drug. It has some known uses. It has some approved FDA uses for parasitic worms, worms that get in your intestines, and that is a drug at a particular dosage that's been studied and shown to work. There's also topical versions of ivermectin for people who have head lice and rosacea. And then there's some uses for large farm animals. And what we're hearing is that people are going to farm stores, and I know this to be a fact because my daughter has a horse, and she goes to the farm store to get some things for her horse, to deworm a horse. And there's a sign up there saying this medication is not for use in humans or for COVID. So people are going out, they're buying medication that's at a dosage and in a formulation for a horse and taking it, which is very, very dangerous. There's no studies that have been conducted yet that show that it's effective for COVID. Certainly not in the formulation and dosage for large farm animals who sometimes are 2,000 pounds. Would you want to take a medication that's made for that animal into your human body? So not approved for COVID, no evidence that it's effective, not an antiviral. This is not a drug like monoclonal antibodies. There's some drugs that have been used as antiviral in other formulations that you might think would be effective with COVID, and you would have some logic behind doing that. This one isn't it. And so it's very dangerous. It can cause serious harm and death. Please do not take ivermectin. Okay, get off my soapbox. I seem to always get on a soapbox every week. So we'll move on to the question and answer session. I looked over once and went, holy Toledo, there's a lot of questions. So this could take a little while. Let me start.
They're mostly comments about...
Oh, there was a problem with the...
A new YouTube requirement.
Okay.
Yeah. We'll work it out.
A little bit about the YouTube. Okay, if the viruses are not technically alive, how do they subsist and live on surfaces outside the body? I will try and bring back some information for you, but it mostly has to do, and if you think about it, bacteria and viruses, they have conditions under which they don't die. We'll say that, right? So for some viruses, heat kills them. For some viruses, cold kills them. For some viruses, without a human or living host, they can only survive for so long. But lots of viruses and bacteria can live on surfaces. So we'll talk about that maybe next week. What about therapeutics? Resources should be spent. It is obvious that the vaccine is ineffective. I'd really be interested to know what makes you think it's obvious that the vaccine is ineffective. I've tried in these presentations to share information such as 5 times as many people get COVID who are unvaccinated and 29 times the hospitalizations if you're unvaccinated. In my book, that study shows that vaccines are effective because if you get the vaccine, you're significantly less likely both to get COVID or to be hospitalized or die with COVID. And so if you have some research or some facts to support your contention that vaccines are ineffective, I'd be happy to respond to that. But there's really no evidence that I'm aware of right now. There are therapeutics. There's things like dexamethasone that they give. I know for my friend who got hospitalized, he had a couple of different treatments. Even after those treatments, he came very close to dying. So those treatments for sure helped him. And I would tell you generally in the medical industry, they feel that compared to when COVID first started, they have a few more things in their arsenal. I don't know if you remember very early on when Italy was hit hard, they were finding that if they kept people off the ventilator as long as possible, if they put people in what we call the prone position, which is face down in bed, where, when you're laying down, a large surface area of your lungs is in what we call the dependent position. That means gravity, right? So if there's a lot of fluid in your lungs, which is what happens with pneumonia, and that's what COVID causes, pneumonia, then all that fluid lays on that large surface area of your lungs and prevents you from getting oxygen. So they found when they put people over on their front, they freed up that part of the lungs, let the fluid go to the front part of your lungs that doesn't have as much surface area, and allowed for a little better oxygenation. And they think that helped people stay off the ventilator. And so the survival rates have improved if you do get in the ICU with the original COVID. The jury's still out on the Delta variant. But the different medications that they are giving now, including steroids like dexamethasone, they think are also helping people either recover more quickly or have less side effects. But still, 100% factual information. The best thing is to either not get COVID or to be vaccinated so that if you do get COVID, you have a less chance of being hospitalized or dying. And the vaccine, it would work better if everyone was vaccinated. If we had been able in the original round of vaccinations to have much higher rates of vaccination, all the evidence is pointing to we might still be having cases, but we'd have fewer hospitalizations and fewer deaths. There are lots and lots of healthcare providers right now who are super frustrated because they're getting these people into the hospital. They're very, very sick. They're dying. They regret not getting vaccinated, and it's too late. And it's very, very frustrating when you go into an industry to care for people and there's a cure or a solution or a medication that isn't being utilized. That can be frustrating for people. Again, not to diminish your right to choose whether or not you want the vaccination and your right to get answers to the questions, but that's the reality right now in healthcare. All right, there's a couple little comments. I'm not going to answer those. They just kind of support that. Any update on the AT&T building? Yeah, so we are working to move forward with some of that. We're also working through the process with architects for the Heritage Campus to be able to relocate our 24/7 operations there. For those of you who've been on the Kings Canyon campus, if you've ever worked in those buildings where our crisis stabilization and psychiatric health facilities are, we're never going to be able to keep up with the maintenance issues there. And so we really think that relocating to Heritage is the best path forward and maybe give us some opportunity to expand as appropriate as well. And so you should look forward to more information in the coming months for what those plans will be. And then just a question about why is a booster necessary? Why are you vaccinated and still wearing a mask? Most vaccinations, there's very few vaccinations that are 100% effective. In fact, I'm not sure any of them are. But think of it as layers of protection. So the vaccination teaches your body what COVID looks like when you confront it and revs up your engine, kind of like warms up your engine so that when it comes into your body has a fighting chance to fight it off versus it's totally foreign, your body doesn't know what to do, and you get really, really sick. And so each of us respond a little differently. That's why, vaccines have variable effects. When we come into contact with someone who has COVID, even when we're vaccinated, there's a few things that can impact it. One is the viral load of the person you come in contact with, whether or not they're wearing a mask, whether or not you're around them for a long period of time in close proximity. And also how your body responds. So we've talked about immune-compromised people. They can get multiple vaccines and their body just can't produce immune responses. And then between you and I might have a better or worse immune response than you. And then the other thing is, this is well known with lots of vaccines, some keep their ability to prime the pump, if you will, to fight off a virus the same. Once you've got them, it's a lifetime response. And others, you need a booster shot. So for instance, shingles is a disease, a virus that people get who are older. They may have had the chickenpox shot back when they were younger, but they get kind of an adult version in shingles. And so they've started giving some booster shots for chickenpox for shingles. And so that's an example of a very well-known, many, many years used vaccine that over time we found may not keep its ability to fight off that virus. And so that booster shot's recommended as we get older. And so because COVID is so contagious and can kill you, we're watching very, very closely individuals who are vaccinated to see how long the effectiveness of the vaccine lasts. And so that booster shot is to reteach your body, to remind it again, it forgot. It's just to remind it again how to fight that off. And then just like we did in the beginning before we had vaccines, it's layers of protection, right? So you get into your car and your car is constructed with some safety features. Some of us have features in our car that automatically slow us down if the car senses you're getting too close to the car in front of you. They're constructed in a way that they have crash zones. We have airbags. We have running lights during the daytime now. All of those are layers of protection that have been added over time as we've learned more about car crashes. We learned about wearing seat belts. When I was a kid, we didn't wear seat belts. We weren't required to wear seat belts. No one of those things is enough to protect you 100% all of the time. But, you know, if you're in a safe car, if you have airbags, if you're wearing your seat belt, if you're following the rules of the road, you're much more likely to both A, not get in an accident, and B, not be tragically killed in an accident or severely maimed in an accident. And so personally for me, I'm willing to do layers of protection. So I'm fully vaccinated. I'm wearing my mask all the time now when I'm out in the public. Do I need it? I don't really care. I just want that extra layer of protection. Okay. Okay, a little bit of back and forth in there. And so I don't see other questions there. I'm going to look on my text and see if there's any questions here. I don't see any questions here. I'm sure more questions will come. Clearly, people have some really strong opinions, and I encourage you to research your opinions and back them up with facts. And as you find facts to support your opinions and you think they're in conflict with mine, I'm more than happy to look at those and comment on it. But opinions are not facts. And so I just encourage you that when you're seeing things on social media or YouTube, those aren't always reliable sources of information. They might come from a reliable source. Something that I try and do when I see something on one news site or social media site, I just Google it and start looking. Is this a fact? Can I support that it's, let's just use for an example that an incident happened somewhere, and if you don't find it on any news sites, it might not be the truth. And if you find that, the only places that it exists are places that are not qualified medical reporters or qualified medical information, you just need to think about that. Where are you getting your information, and what can you find to support that opinion or belief? Okay, do we have one?
Yeah.
Okay.
On the chat.
Okay, maybe I didn't go down far enough. Oh, if a child recovers from COVID and becomes ill later on, can a child be diagnosed with the multi-system inflammation and test negative for COVID? That is a question I'll have to get an answer for you. I am not a medical doctor, and I've not dealt with kids with this condition, but we will record that question, and we'll get an answer for you. I will tell you that there are, like for instance, my friend who was in the hospital for several weeks, the hospital stopped counting that person as COVID once they've passed so many days. And you can test negative for COVID and still be hospitalized from the effects of having COVID. And so it could be possible that you could develop a condition related to your being sick with COVID. So for instance, like with my friend, he's really debilitated. Like he can't walk very far in his own home on oxygen because he still has remnants of the COVID pneumonia. And so we do hear situations where people have recovered in the term of they've gotten well enough to go home, but they're still not out of the woods yet. And so I'll look into that, and we'll see that. All right. I don't see any other questions. Again, if you're watching this via the recording and you have any questions that we weren't able to answer today or that didn't come up on the live update, please feel free to text myself and Tina Young, and we'll be happy to get answers for you. And we will report back next week. Thank you. Have a nice weekend.